Welcome back after the break, everyone. My name is Midnight. I am the Executive Director of AppCom. We are a regional community network based in Bangkok, working on issues around HIV and those that advance the rights, health, and well-being of people of diverse sexual orientation, gender identity, gender expression, and sex characteristics. Welcome to Session 1, Impact of Stigma on You equals You, Part 1, Real-World Voices. I am very honored to be chairing this session. We will hear from 4 speakers from the region, and then I will have the pleasure of facilitating some discussions afterwards. Without further ado, our first speaker is Martin Choo. He is from Asia Pacific Council of AIDS Service Organization based in Malaysia. Martin is the Managing Director and Trustee of the Asia Pacific Council of AIDS Service Organizations. Martin is a member of the WHO Steering Group on HIV Drug Resistance Research Network. Martin believes in and fights for equitable and sustainable access to HIV treatment. He has been living with HIV since 2004. Martin's presentation is titled, What You Equal You Means for a Person.
I'm Martin Choo. I'm a person living with HIV in Malaysia. I run a charity supporting services to end AIDS, basically, in Southeast Asia. Our focus is in Southeast Asia and Asia Pacific. U equals U is a difficult subject. I think for us in science, some of us tell it as if it's easy because we obviously understand it. But for many of us, especially if we're not trained in science, it's quite a big leap, right? You're trying to figure out how is it, how are they so sure? How come there will not be any transmission? How would they know? We know 2 ways. First way is we know how the virus transmits. We know the mechanism, the way the virus enters the body, and what cells it latches onto, and how it injects its viral material into the body. We know that. We also know how much of the virus, how active the virus needs to be, how high the viral load needs to be for the virus to transmit. There is a confidence interval, so to speak. And it depends sometimes on the person. But we also know how much active ingredients are in the medication that you're going to take, or even if you're not positive, that somebody is going to take. And we know how effective, how quickly your body clears it. So we know how effective that medication is and how long it stays effective. When we calculate everything, we can tell you quite honestly and straight up that if you adhere to your medication, you will definitely suppress HIV. If you look at people, or if somebody tells you that they can't, that means that the medication that they take is not efficacious for them. It's not the best fit. Put a shorter word. It's not the best fit for them. Well, get a better fit then. Talk to your doctor. Your doctor should be able to give you a better fit. That's what public health has done. There are grades of medication. Of course, there is a cost involved. But if you can show that whatever you're taking now is not good for you. It could be weird dreams, non-stop. It could be lots of things. Whatever you're feeling, whatever is not working, talk to someone. There are people who can help you. You don't have to do this alone. But what we need to do in public health is to make sure that we give everybody a fair chance to that information. Right? It cannot be in a way that they cannot understand. It cannot be put in a way that it will take too much of science to even just get past the first paragraph. Or if people who don't read very well, there is nothing for them. So there's no videos, as far as I know, in many languages on U equals U. Somebody should make them. Somebody should vet the science behind it and present it. We need to reach. U equals U only works when many people do it. Because the medication is so effective these days that it will suppress the virus, sure. But we don't have a normal epidemic in Southeast Asia. I'm talking only from my point of view. We don't have a normal epidemic. We have a close one eye epidemic, you know? All the figures that you see, you can close one eye to see them. Why do I say that? Because certain things are not counted very well. We know what those are. So I can safely tell you that whatever the figures are, it's much higher. I can safely tell you that straight away. And it's much higher, more for certain people than for others. The risk is higher for certain people than for others. In Southeast Asia, it's the youth. If you're under 25 years old, in Southeast Asia, in certain countries, in 6 countries, your risk is pretty high. There are 2 choices, actually, that we know that are going to be very, very good. If you're not infected, try PrEP, pre-exposure prophylaxis. Ask your doctor for PrEP. It's 1 pill, once a day. If your doctor gives you a lot of a lecture on only taking a certain time of day, yes, it's important, but don't lose sleep over that. You just need to take it every day, or as doctors advise. Okay. The other is HIV antiretroviral therapy. Also amazing. That's the thing that's going to end AIDS. So we've got 2 options. Then there's condoms. Then there's no sex. Then there's what we call combination prevention. So you have many options to choose. Nobody needs to get AIDS. Nobody needs to become infected with HIV in the 21st century, not in Southeast Asia, because most of this is available for free. Our problem is not that the medication is not in the hospital. Our problem now is not enough people are going to the hospital. Or once they start, then suddenly they disappear. So our problems are complex, and they're not usual ones for medication that's already free. Okay, but that's the case, and we must learn to understand which of the people who are most at risk and reach out to them. So it's the 21st century. We can end AIDS. I think we can end AIDS today, but maybe I'm a bit late with time. I'm a bit poor with time. So maybe tomorrow, because the science is clear. The medication is available. It is free for most people anyway. So you just need to get tested and access it. Or if you're already positive, now's the time to access it. Once you suppress your virus, you are a public benefit. Remember that. You are the safest person to have sex in the world. That should improve your market. So go out there, enjoy yourself if you're young, but make sure you do it with as little harm to yourself as possible. And one of those is not to become infected. If you are, don't lose sleep over it. I've been infected now. I've been living with HIV for 15 years. And it's okay. It's not perfect, but it's okay because of medication. So, untransmittable is undetectable is untransmittable. And that's the key. We just need to explain this in a way that people understand. And I hope I've done it today. Thank you.